So there's a lot to be optimistic about when it comes to COVID-19, but there are still reasons to believe that this pandemic is not over. Vaccination rates vary wildly from county to county, and there are new variants that are spreading right now. So we're joined live by Dr. Jeff Potoff with UW Health. Doctor, thank you for being here.
Yeah, for sure.
What do you expect this pandemic to look like a couple months from now? Will it still be going on?
I still think we'll be talking about COVID. As we go through the summer, one of the things that has us a little bit concerned is that Delta variant, and not for vaccinated people. Folks who are fully vaccinated, it really is a good scenario where you can do kind of whatever you want to do, minus a few specific exceptions. But for those who are unvaccinated, the Delta variant's more contagious. It looks to cause a little bit more severe disease. And I think we could see little hot spots pop up going into late summer, fall, and communities, particularly those communities that are not well vaccinated.
Yeah, I do want to ask you, with restrictions being lifted, people gathering in crowds again, we saw the big crowds in the Deer District during the Bucks playoff run. Do people still need to be concerned about large crowds right now?
Well, you need to be concerned if you're unvaccinated. And I think, when I'm out in public and I realize that about 50% of the state is vaccinated, when I go out in public, it's far more than 50% of people who are unmasked and not paying attention to distance. And what that does is it creates a scenario for those who are unvaccinated, but yet out in public, close to others, not masked, not distanced. They're putting themselves at some risk. It really is a tale of two cities, the vaccinated versus the unvaccinated. And, that could create some problems for them.
I also want to ask you about the Delta variant that you mentioned. In some parts of the country, this variant is being blamed right now for an alarming increase in hospitalizations. Is that a threat here in Wisconsin right now, or what is the threat here in Wisconsin when you think of the Delta variant?
Yeah, I think as it pertains to the Delta variant, we're still not seeing a significant amount of it here in Wisconsin, but it is a threat, going into the future. And the threat for the Delta Delta variant is for increased cases, increased hospitalizations, not to the same extent that we saw last fall when we had basically nobody vaccinated, but is a particular concern for those areas of the state where vaccination rates are very low. Citizens in those areas of the state are susceptible to it. They could get sick. They could wind up in the hospital.
I also very quickly want to ask you about COVID-19 long haulers. What do we need to be aware of when we think about the long-term impacts of those who have survived COVID-19?
Yeah, I think there's a couple of things. I think the most important thing is to remember that COVID isn't like, you live or you die. It is oftentimes you live, but now your life has changed because you have these long haul symptoms, whether it's fatigue or headaches or fogginess in your thinking. If you're someone who's suffering from those things, realize you're not alone. And the best place to start as you start looking at how do I get care for this is probably your regular doctor, your primary care physician, who can help connect you with the right resources. We do have some experience with post-viral syndromes like this. It just seems to happen a whole lot more often with COVID-19.
All right, Dr. Jeff Potoff with UW Health, thank you so much for joining us.